case. There is no day they discourage us in the process, even in there are times that we there are challenges, but they encourage us that everything will be fine. But at the end of the day, our dream really came true.
Okay, sir.
So now we are happy with our children, and also the children are doing fine, they are healthy, and they are bouncing for the Lord. So, and I pray for Joje Hospital, right from the reception to the top manager, that everybody that makes up Joje's team, that the Lord will be with you all and make your dream come true. Happy eight uh, 8 years anniversary. I pray the Lord will renew your strength. You will not make mistake. The Lord will begin to expand you and make all your efforts fruitful in Jesus' name. From the family of Mr. and Mrs. Taiwo and our twins by name, Hallelujah and Amen, we are saying thank you and happy 8 years anniversary. God bless you.
Congratulations to Joje Hospital. God bless you all. Have a lovely day and enjoy your celebration. Thank you. Good afternoon, Joje Hospital. Good afternoon, Dr. John Abibi. Good afternoon, all the nurses and all the workers in Joje Hospital. I want to say thank you all. I send this voice record to congratulate you on your 8 years anniversary, and I say a big thank you. My name is Beatrice Anyebe. I have been one of your patients in Joje Hospital. I love the way you walk. I love the way you treat your patients. I love the way you welcome your patients. All I want to say is congratulations for your 8 years anniversary today. All I want to say, God will continue to guide and protect all the workers in Joje Hospital. God will continue to give you testimonies. IVS baby will be successful. Many testimony will come. Blessings will come. Favor will come. God will bless Dr. and Mrs. John Abibi for their kind-hearted job they are doing. God will continue to bless and protect them, protect their hospital, and every desire of every member, every client that comes into Joje Hospital shall live with testimony. The blessings of God that maketh rich, that added no sorrow, shall be upon Joje Hospital, and every good thing they desire in that hospital shall come to pass. I want to say congratulations. Congratulations to Joje Hospital. God bless you all. Have a lovely day and enjoy your celebration. Thank you.
Ah, okay. This is what is causing the. But I thought some of you love AC so much. Okay, so those ones behind, who should come? But some people they just like to just stay at the rear corner. I don't understand why. This front is not meant for any special guest. People should come. So that those who come late who can they can just go behind without causing. All right, so good afternoon once again, and you're welcome to this month's antenatal class. How are we doing? We're doing good. I want to say congratulations to those who just newly started their journey. For those who have gone far, I say well done. The journey is getting closer, and I believe God that very shortly we shall take delivery of our bundles of joy. All right, so today we're looking at something very short. All right, my symptoms of pregnancy normal. Just wanted to just talk a bit about the symptoms of pregnancy. When a woman gets pregnant and she's going through a lot, a lot of times she's wondering in her mind if what she's going through is normal or not. Particularly if that is her first pregnancy. And for a lot of us, it's probably the first pregnancy we're having or first pregnancy in a long while. So you are wondering, even those who have been pregnant before, they've forgotten how it felt. And I wonder, did I feel this in the last time? Remember, are you sure this is normal? And usually the women tell their husbands, I'm sure the men here, you very witness, you get all the, I'm feeling like this, I'm feeling like this, I'm feeling like this. And the man will say, I think it's okay. If it's too much, call your doctor. Call doctor. All right. So we want to go through the various symptoms that affect in pregnancy. Pregnancy is divided into three phases. You have first trimester, second trimester, and the third trimester. And most of the symptoms that a woman feels, they are different for different trimesters. What you feel when you're in your first trimester, not the same with what you feel when you're in your second trimester or when you're in the third trimester. And a lot of the symptoms that are quite dramatic are felt during the first trimester. So I will start by saying that it is perfectly normal not to feel any pregnancy symptoms at all. Now, some of us who are pregnant and they are wondering, doctor, are you sure I'm pregnant? I'm not feeling anything. No. I thought they said when women are pregnant, they begin to spit everywhere, they begin to throw up, they are tired. I'm still very strong. Nothing in me has changed. Are you sure I'm pregnant? Well, you are knowing today that it is perfectly normal not to feel any pregnancy symptoms. How many of us want to be perfectly okay and not feel anything at all when they are pregnant? Not everybody. Okay, how many of you want to feel something, want to feel pregnant? Nobody. Hey, then why you getting worried now when you don't feel anything? Eh? Since none of you want to feel anything. Well, I guess it's just the validation to show that, oh, truly something is happening. I'm feeling different. All right. But just to know that not everybody will have pregnancy symptoms. Why? Because everybody is different. No two women are the same. All right. And that's why you cannot compare one pregnancy to another, even in the same woman. Her pregnancies from one to the other will be different. All right? So some may not even be aware that they are pregnant. The only reason why you are aware you are pregnant is because you went through a process, you went through a treatment program, so you will know. Those who get pregnant continuously, sometimes pregnancy has even gone beyond first trimester before they even begin to realize that, come on, this is my period. For those who don't even count period, for those whose period are even irregular, they don't even see it 2 months, 3 months, 4 months, they won't see period at all. When those people get pregnant, they won't even know. There are those that they only get to know when they want to deliver. How many of you have seen that story before? I didn't know I was pregnant. And you begin to wonder, how will a woman not know she's pregnant for 9 months? It is when she enters labor and she starts having labor pain. And you now start complaining of pain. Pain, I'm having pain, I'm having pain. And then she goes to the hospital and says, woman, baby is about to come out. Baby, where? Pregnant. It's how? It's very strange. All right? So, but there's one aspect of symptoms that I want to say here, and that is if you were having a lot of symptoms before, particularly in the early first trimester, and you notice that those symptoms have disappeared, like completely in the first trimester, then it's still not a cause for alarm, but I would suggest that you go to the hospital. All right? But if the symptoms you were having in them very heavy, welcome, very heavy in the first trimester, and you get into the second trimester and you notice a dramatic change, it is normal. It is very normal. I usually refer to the first trimester as the takeoff stage. When a plane wants to take off, there are three phases in a plane's flight. You have when the plane would taxi and get to the runway to take off, and it will start going and then lift up and then start going, climbing until it gets to the cruising altitude, and then will now stabilize there. And then the plane now begins to cruise, and then that is the second phase. The third phase, when the plane now begins to descend and wants to land. The first trimester is that takeoff stage. Second trimester is the cruising stage. Third trimester is the descent and land. The two most important, very disturbing, are usually the first and the last. The woman will feel all the symptoms, First pregnancy, first trimester, she's feeling uncomfortable, vomiting. Too many things are not just right. And then she wakes up one morning and doesn't feel anything at all. What just happened? She went to bed pregnant, woke up not pregnant. And if that happens around the 13th, 14th, 15th week, what just happened is that you just got to your all of those symptoms of pregnancy have disappeared. Why? Because the hormone, human chorionic gonadotropin, has stopped. That is what really makes you feel pregnant, the hormone of pregnancy. Now you're now feeling perfectly okay. That is the phase that all women crave for. Some have it all through. Some have it in the second trimester. Some they don't have it at all. Even in the second trimester, when things should be stabilized, it's still not normal. Particularly those who have multiple pregnancies, who are carrying multiple pregnancies. All right. But if, however, you are 8 weeks, 7 weeks, 9 weeks, you're feeling very pregnant, and suddenly no symptoms at all, it will be good for you to go to the hospital for a checkup. Okay, so next. So is nausea, vomiting normal? What is the answer? Yes. But it depends. There's the kind of nausea and vomiting that you have that will not be normal. And that is the nausea and vomiting where you cannot tolerate any food or anything that goes in comes out. And once you have that kind of situation, it is not normal. That is what we call hyperemesis gravidarum. All right? Meaning, emesis means vomiting. Hyperemesis means hyper, higher level. You cannot tolerate any food at all. And once you have that, you will need to be admitted in a hospital. But generally, vomiting early in the morning, when you're particularly when you're brushing, or in the afternoon or night. Sometimes some people's vomiting doesn't have pattern. We say morning sickness. That means you vomit in the morning. Some people's vomiting is in the afternoon, and some is in the night. Some is morning, afternoon, night. But most times, it's usually in the morning that a lot of women will throw up. So once a day, not a problem. For those ones, they're able to they throw up and then they're still able to eat, tolerate food, and that doesn't cause a challenge. But if you're not able to tolerate food at all, then you need to come to the hospital. You need to be admitted, you need to be rehydrated, and we need to stop that vomiting. All right? If not, it could lead to something else. Next, I'm always feeling sleepy and tired. Is it normal? How many of us felt this during the early stage of pregnancy? Or how many people are still feeling it right now? Those who are in the early stage of pregnancy. Yes. Always feeling sleepy. You slept well at night. Morning has come. You are still feeling sleepy. What is happening? You that I used to be a very agile, active person. Suddenly, every moment, you're feeling like sleeping. Don't worry, it is normal. Okay, it is perfectly normal. It's one of the symptoms, and it is due to hormonal effect. All right, so there's no cause for alarm. It's not sleeping sickness caused by fly. So it's pregnancy that is causing this. Okay, so next, is this abdominal cramps normal? It's very important for us to know that women, when they are pregnant, they have cramps, bit of cramps, mild. If it's a mild cramp, then that is normal. That is in the first trimester, second trimester, or third trimester. But in the third trimester, those cramps are called Brasileus contractions. They are usually painless or a bit of discomfort you have when you're having those contractions, but they are perfectly normal. Brasileus contractions. In the first trimester, you may have a bit of mild contraction. Sometimes during the process of implantation, you will have those contractions, and that is perfectly okay. However, if these contractions become very severe, very painful, then that no longer is normal. Particularly if you now start having spotting or bleeding together with it and you're pregnant, then that is not normal. That could just be a sign of a miscarriage that is about to take. So it's important for you to be able to differentiate between mild contractions, cramps, all right, or severe cramps. And how do you differentiate them? Mild cramps, it doesn't disturb your work. You can be having it and just be doing your normal activity, just so that you feel a bit of discomfort. But when you start having severe cramps, you can't continue with whatever you are doing. It will make you stop. You feel that yes, you are really having pain, then you need to visit a hospital. If you're having those cramps, it could be due to infection, UTI, fibroid, adenomyosis. Like I said before, if it's in the first trimester, it could be due to a miscarriage that is about to take place. So you need to make sure visit the hospital. And then we say that you avoid dehydration because when you are dehydrated, it can actually cause you to have cramps. So a lot of patients when they call me and they tell me, doctor, I'm having cramps. Not so much, but yes. Do you know what I tell you to do? And it works. What? Exactly. Take water. Just take water. And you'll be surprised the cramps will just stop. You know why? A lot of you don't take water. Abi? Exactly. They don't take water. So when I see women come to antenatal with bottle of water, I'm happy. I'm jubilated. I say, hey, thank God. Oh. Hmm? So please make sure you take water. Hmm? Take water. Well, thank God we're in the rainy season now when women are not sweating a lot. But when you get to dry season in particular, you know we live in a very hot, you know, climate, uh, climate where you sweat a lot and you lose water. For a woman who is pregnant, because of the vasodilatation that takes place, you lose a lot of water. Actually. So it's important for you to ensure you're hydrated. Once you are dehydrated, you would begin to cramp. Now, when you are pregnant and you now begin to throw up, or you may not even throw up, but you are salivating, excessive salivation, all of that will make you to be dehydrated. So it will be important for you to ensure that you're well hydrated. All right. Next. I'm seeing blood. Is it normal? What is the answer? Not normal. No pregnant woman wants to see blood at all. Blood. Hmm. It can be very scary. Once you tell a woman that she's pregnant, for 9 months, blood should be far, 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 will far away. Just go. Go. Don't come near me at all. You know, it's very funny. When a woman is not pregnant and she's not seeing period, she'll be praying for her to see period, to see blood. She doesn't see blood and she's not pregnant. What is happening? Hey, blood, come, blood. Where have you been to come? I want to see blood. Then when she's pregnant, blood, don't come near. All right. So once they see blood like this, like, what is happening? All right. So it is not usually normal to have vaginal bleeding during pregnancy. Okay. So when you're in your first trimester and very early in the first trimester, particularly if you've had a procedure like an IVF and you spotting the spots, not bleeding, spots. When I mean spot, you'll probably just see some brownish discharge, pinkish discharge. All right, you just know that yes, there's a blood that's coming out. All right, that is okay, particularly if you are in the first trimester, in the first 2 weeks, 3 weeks after implantation, sorry, after transfer. What is happening that you're having what we call an implantation bleed. All right, so that is normal. And then when you are confirmed pregnant, a bit of spot here and there, not too alarming. Okay, so if you're saying, oh, you have to put on a pattern liner, not use of pad because it's not so much, fine. Or process of implantation going on and on like that, the placenta is forming. However, if the bleeding becomes more severe, more severe, now you are seeing frank blood, and worse, if you are seeing clots of blood, uh, if it's particularly if it's associated with abdominal cramps, then you know that that is not good. Or what is happening if it's in the first trimester, it means that the pregnancy is being threatened seriously. So you need to get to the hospital. Right? So like I said, it could mean that you're having a miscarriage. So, however, so once you see blood, the thing to do is to call the doctor or call the nurse to say this is what I'm seeing. Then they will advise you accordingly. Now, if it's in the second trimester, because bleeding in the first trimester is the implication is different from in the second trimester and in the third trimester. Why? Because of the cause of the bleeding. Most bleedings in the first trimesters are usually due to threatened, when the pregnancy is being threatened. Right? Miscarriages are what we cause bleeding. In the second trimester is usually due to, if it's in the first part of the second trimester, yes, threat of miscarriage can also occur, but later in the second trimester is usually due to placentation, where the placenta is located. If the placenta is located low, then you could begin to have bleed. Or if there's a premature placenta separation, that is very, very devastating. That's what usually causes bleed in the second and in the third trimester. Okay. Then next, excuse me, my appetite has not changed. Is it normal? There are people who believe that they said that when you get pregnant, you'll be eating anyhow, eating everything. No, it's not true. As some of you would have witnessed. Some women may not even have an appetite at all. Some the appetite will be doing like this, will be changing. Alright? There are some whose appetite will increase, some it will decrease, and some it will remain perfectly normal. All of these are all normal. Okay? They're all normal. What we normally advise is that women should just go with what is happening to them at the time. There are some women who have very significant crave for certain things. As long as it is not harmful, it's okay. And there are some women who have crave for things they didn't used to like before. Suddenly they now begin to like it. That's all they want to eat. As long as it's okay, no problem. But if you say my crave is for alcohol, lie, cancel. And you know that some women who have very bad crave for alcohol. In fact, just give me let me just perceive it and I'll be fine. uh, no. All right. So appetite, some will change, some will not change. All of those are all okay. And then some women may have some peculiar cravings. Okay. Next. I'm always getting angry. It's normal. Mood swings are common in pregnancy. One moment you are happy, that moment crying. And the husband is confused. What happened? What did I do? Is it me? Is it what I said? Men, just know that women, when they are pregnant, have what we call mood